Hello everyone, my name is Christina Kahale. My research project is on breast cancer, and I will be discussing some general information about breast cancer and new research and advancements that are currently being studied. So let's get started. So an overview on breast cancer. The breast is made up of lobules, which the lobules make milk, ducts, the ducts that carry milk from the lobules to the nipple, made up of fat, lymph nodes, connective tissue, and blood vessels. So breast cancer is a disease in which the cancer cells attack tissues of the breast. Breast cancer most often begins in the cells of the duct, also known as ductal carcinoma, and can also begin in the lobule cells or the tissues. Breast cancer is the second most common cause of cancer-related deaths in women in the United States. It is estimated that 23,000 new cases of breast cancer occur in women every year. So risk factors, symptoms, and screenings. So some risk factors for the development of breast cancer include age. The older you get, the higher your chances are for developing breast cancer. History, such as family history of breast cancer. You have a higher risk among women with close relatives who have breast cancer. Having a first-degree relative with breast cancer doubles your risk of you getting it. Also, early menstruation, delayed menopause, having a first pregnancy after the age of 30, oral contraceptive use, radiation therapy use, having increased breast density, alcohol use. So those who have 2 to 5 drinks daily have a 1.5 times more likely chance of developing breast cancer than women who do not drink at all. Also, smoking. Long-term heavy smoking increases your risk. Genetics play an important role. 5 to 10% of breast cancers are heredity. So the most common inherited mutation is the BRCA1 and BRCA2 gene. Having this mutated gene means that you have a higher risk of developing breast cancer in your lifetime. Gender, just being a woman increases your risk 100 times more than a man. This can be due to, that women have higher levels of estrogen and progesterone in their bodies, which promote cell growth. Personal history. If you personally have had breast cancer before, you have a 3 to 4 times more likely chance of developing it again. And a last fairly recent finding, which is very interesting, is that those who work at night, so women who work at night, such as night shift nurses, have an increased risk of developing breast cancer as well. And the possibility for this, which still research is going on, is that because of the changes of melatonin in your body. Symptoms for breast cancer. So symptoms for breast cancer can include having lumps, nipple tenderness, thickening near the breast or the underarm area, any changes in skin texture, which include, changes also in breast appearance, size, shape, dimpling, swelling or shrinkage, inward or inverted nipples, and any color change like a red or scaly, similar to an orange peel, and also any nipple discharge. So some screenings for breast cancer include physical exams and history, which the exam will be on your body to check for any lumps or anything that is abnormal. Also, lab tests such as blood, urine, or tissue samples can be taken. Imaging procedures such as mammograms, genetic tests can be done, and those look for changes in mutations with their links with certain types of cancers. So it is very, very important, that everyone knows the signs and symptoms of breast cancer and to go to their healthcare provider if they see any. Treatment options for breast cancer. There are various options for treatment. One example is surgery. surgery involves removing cancers from the cancer from the breast. First type is lumpectomy. Lumpectomy removes the tumor or the lump and also a small amount of normal tissue. Partial mastectomy, which is removal of part of the breast that has a cancer and also some normal tissue is removed. Total mastectomy, that is removal of the whole breast, also known as simple mastectomy. And this also removes lymph nodes for biopsy if needed. Modified radical mastectomy, that's removal of the whole breast and many lymph nodes, also the lining of the chest muscles and part of the chest wall muscles. Another type of treatment is radiation. Radiation uses high energy X-rays to kill the cells or keep them from growing. There's two types of radiation. There's external and then there's internal. External is a machine that's outside of the body and that's used to kill the cancer cells. And there's an internal type of radiation, which is a seed or a wire that is placed into the body to kill the cancer cells, and these are often placed near the cancer in the body. Next option is chemotherapy. Chemotherapy is medication or drug use that prevents cancer cells from growing or dividing. Targeted therapy, that is using substances to attack cancer cells without damaging normal cells. And also there's hormonal therapy. Hormonal therapy is removal of a hormone, for example, estrogen, to block or stop the cells from growing. So some current breast cancer research that's going on on clinical trials. Current breast cancer research includes clinical trials focusing on the combination of medications that aim at the components of the key intracellular pathway. Also, this focuses on extracellular and intracellular domains of cell membrane receptor rates, while comparing it to a single targeted agent with and without the use of chemotherapy. So there are many patients with breast cancer that are ER positive and are treated with endocrine therapy. ER positive is about 75% of all breast cancers, and they grow in response to the hormone estrogen. But this can prove to be a challenge because sometimes there's resistance with the endocrine, so endocrine resistance. So there are ways to defeat this signaling pathway being studied currently in phase 2, and phase 3 clinical trials. These studies include observing the combination of an mTOR inhibitor and also an mTOR inhibitor regulates cellular metabolism, growth, and proliferation, and with an aromatase inhibitor, which decreases the body's estrogen by blocking the enzyme that turns androgen into estrogen. And the combination of these to see if it would result in a greater tumor response rate with tamoxifen combined with the mTOR inhibitor, and to see if it will overcome the endocrine resistance. And if you don't know, tamoxifen is a medication that blocks the effects of estrogen. So the results of these trials are very promising but are still awaited. Another trial is HER2 positive breast cancer is being studied with trastuzumab. So HER2 breast cancer is a type of breast cancer that tests positive for the protein called human epidural growth factor receptor 2, and it makes the cells grow faster and more likely to spread. And trastuzumab is an antibody that has anti-tumor effects and that blocks the HER2 cleavage and improves response rate compared to chemotherapy. Currently, there's a phase 3 trial being completed using trastuzumab-based antibody and comparing it with capecitabine and lapitamide, which are dual tyrosine kinase inhibitors that interrupt the HER2 and growth factor pathways. So there are new advances, being made, and it is hoped that in the future, breast cancer will be controlled and curable. And here is my list of references. Thank you very much for watching. Hope you learned some new information.